Today we've got an interesting topic in regards to insurance. And you know, if you ever wondered if MOROF really has their finger on the pulse of what's going on in healthcare, we've had several presentations this year where we have planned the topic, and literally within a week to 2 weeks prior to the presentation, rulings come down, laws get changed, whatever, and it makes the topic so timely. And that is definitely the case of what we have in our conversations today about healthcare and insurance and all the changes that are happening that are going to affect obviously the medical practices, the doctors, and also the patients, which, you know, no matter who you are, if you're alive and breathing, you're in one of those categories. So it's definitely going to impact and affect you with all the different new regulation that just came down the pipe within the last 2 weeks. So I know our speakers have been kind of scrambling to update their presentations and to make things change and affected in that regard. And we've had a few other presentations this year where it's had similar type of impact, like when we did a presentation on ADA compliance for your website and such, and like a week before the event, there was a big ruling that came down federally saying, you know, Winn-Dixie, you are being, you know, charged, you have to make your website ADA compliant. So it's really interesting to see how much MOROF really does have a pulse on what's going on. So without any further ado, I am going to introduce our two speakers that we have. And Craig is going to be speaking first, and then Mitchell, both of which are involved with MOROF, so you might be kind of familiar with them. But Craig Rodriguez is a UCF grad, and he has been with his insurance company for business for over 25 years. But really what qualifies him to be speaking is that he has been involved in the insurance discussions, planning, government and business issues, and he appears as a topic speaker for business and entrepreneurial meetings and conventions. He testified for the Florida Department of Insurance, serves as the advisory council for AvMed Health Plans, serves as committee chair for National Association of Insurance and Financial Advisors, and is regularly recognized as a top contributing agent by major insurance carriers for meeting client needs and all those sort of things. So he's really been involved all along his career in the legislative part of things and a great advisor. So we have a great resource that can really tap into what's going on today and where we best guess things are going to go down the road for the future. The other speaker is Mitchell Gordon. He has a marketing degree from Nassau College in New York. He's been in Central Florida for 47 years. He owns Gordon. He owned a contracting company for many years. He owned a marketing company. Now he's doing Gordon Insurance Group for the past 19 years and really specializes in Medicare for the last 7 years. And while there may not be as many changes that are impacting Medicare and those things, there are always a few things that change in that regard. So let's give a warm MOROF welcome to Mitch and Craig.
And actually, Mitchell's going first, is our understanding. So, yep, we're going to let Mitchell go. And then
I apologize to those who have heard me speak in the last 3 weeks because it's annual election period, because a lot of it's going to be the same. But I'm going to mostly speak on the compliance issues and the rules and regulations, which are very strict. First, to start off with, health care is a service. Health insurance is a product, just so you understand, okay? Medicare, as you know, has 4 parts. It's Part A, B, C, and D. Part A deals with the hospitals. Part B deals with the doctors. Part C deals with the replacement plans that replace Medicare. The government subs out the care, and that way there's an insurance company taking care of you. And Part D are prescriptions. Now, healthcare, when it comes to Medicare, the government is not supplying you the health care. With the hospitals, you pay a deductible. That doesn't change very often. There have been very few legislative or legal changes in the last few years in Medicare. For those of us who have Medicare, we're pretty safe with where the program is. The magic number I hear all the time is 55. So when they start making drastic changes, if you're under 55, you're going to get hit with them. If you're over 55, you're going to be able to use the same plans that they have now and the same programs. The basic changes in Medicare itself are just the prices. The prices go up for Part A and for Part B. Part A has a deductible. You turn 65, you don't pay for it. You've worked 10 years, 40 quarters, and you're entitled to Part A. By the way, 90% of what I tell you, there will be an exception to each one of them. You can buy Part A, outrageously expensive if you've only been working for a few years. Part B is optional. The government's definition of optional means you don't have to take it. If you don't, we're going to penalize you. 10% a year. So if you wait till you're 70 and don't take it, you're going to pay 150% of what normally you would have paid. Here's the exception. If you are already insured and have creditable coverage, which means you are covered by a company plan or a private plan that you're able to keep past 65, which is usually group or in retirement, and it equals Medicare or better, you have creditable coverage. You do not have to take your Part B, and there's a special reason not to, and I'll explain that later. Again, if you have creditable coverage, you make sure you get something written from your company that's creditable for medical and prescriptions, because they're different parts of the plan. I'll skip Part C for now and get into Part D. Part D is also same rule. It's optional. You're 65, you're healthy, I don't need prescriptions, I don't need to take it. Well, the government will penalize you 1% a month. I know people that are above 100%, they're up to 108% penalties because they never took it. So even if you're not taking prescriptions, you might want that to have Part D. I wrote a couple of notes because the numbers change. Part A has about a $1,300 deductible right now. They won't even tell us what the change is going to be until about December, January. Part B has a premium of $134. It's going to be next year. This year, for some people, it's $121. For some people, it's $112. It varies depending upon when you got into the program, when you got your Social Security, and again, how much money you make. If you're making a lot of money, they'll start charging you more. Okay? But there's also a deductible for Part B. So when you go to the doctors, you pay a deductible, about $183 this year. That also may change. So just like Social Security was just meant to help you, it wasn't meant to support you. You had your pensions and you had your savings, and Social Security, that gave you a nice retirement. I truly believe Medicare is the same thing. Medicare wasn't made to cover everything that you need. It was made to help and support you with all the other things that you have. So when you get Medicare, and in 7 years and over 300 clients, I've only met one person that only has Medicare and only wanted Medicare. There are two directions to go in. And by the way, it's also, Medicare isn't as complicated as you think it is. If you take someone out for lunch and you charge it off on your taxes, you don't have to know the whole tax code. I don't think accountants know the entire tax code. What is it, 1 million pages? Well, same thing with Medicare. You don't have to know the whole system. You just have to know what affects you and how to use it. So Medicare has two directions to go in. You can get the Part C, which is a replacement plan, or you can get a supplement. And very simply, the replacement plans, the government subs out to an insurance company. Just like when you build your house, your general contractor subs out the drywall, the electrical, the plumbing. Well, the government subcontracts out to all the different companies your medical care. They pay them X amount of dollars, let's say $1,000 a month. You don't go to the doctor, the company just made $1,000. God forbid you get cancer and it costs $1 million, that company's going to pay the $1 million. You don't lose your Medicare, you just put the card in a safe place in your house, and now you're covered by a company. The advantage to the Advantage plans are really good. 0 premiums for 99% of the plans I present in Central Florida, all over the state actually I work. 0 copay to go see your primary care doctor. Now that's great because if you want to go, there are people that go to the doctor like 3 times a month. Very low copay to go see specialists. Low copays to go to the hospital. It might be anywhere from $150 to $300 a day, but only for the first 4 or 5 days or 8 days. And then after that, for the whole year, it's 0. So you can be in the hospital for 60 days and not pay more than $1,600. That's a great advantage. The disadvantages are you're networked. You have to stay in network unless you get a PPO. PPO allows you to go out of network. Surprisingly, here's the secret about PPOs that you've got to understand. The doctor you go to has to accept the assignment price from the insurance company. If they don't, the PPO becomes worthless and you have to pay the doctor the full price. So either way, whatever doctor you go to has to accept assignment price from Medicare. So that's the disadvantage. Another advantage to the Advantage plan is it includes a prescription plan in it. You don't pay extra for it, you just pay discounted prices for your prescriptions. So again, I like to use a lot of examples. There's a product for every purpose and a purpose for every product. And the example you heard me use last time, if you're delivering hay, are you going to buy a motorcycle or a pickup truck? Well, it's the same thing. If you're in a financial situation where you can't afford anything, your Social Security is the only money you've got and it's very little, your main priority is cost. Who can I get that's going to be the lowest copays for my program? You're not as worried about how many doctors you can choose from. Then, if you can afford a better plan, you decide, okay, do I want to be able to pick from 3 cardiologists or 30 cardiologists? Well, that's the plan you look at. And again, there are this many choices to choose from Medicare. There are about, at least now, I'm appointed with 9 or 10 companies for the state of Florida, and each one has 10, 15 plans. You look up Medicare.gov, you're going to get lost. All an agent has to do is ask you one question, and it shortens down your choices down to here, okay? The question is, what doctor do you refuse to give up? Not what doctor do you like, who do you refuse to give up? Once an agent learns that, he only has to look up the plans that those doctors take. So it makes it a much easier choice. If you don't care, then you could look at any other doctor and any other plan you want. So the Advantage plan, some people, I had someone almost attack me because they didn't like the Advantage plans because they had to go through so many hoops. But they serve their purpose. They also have a maximum out of pocket. It's called MOOP, which means that's the most you can pay for your medical service for that year. Medicare does not have that. Medicare Part B, you pay 20%. Well, you have a $100 bill, that's pretty cheap. But what happens when your bill hits $20,000, $30,000, $40,000, $50,000, $80,000, $100,000? Then you're starting to hit 20%, starts to get to be a lot. And that's the difference. So that's the advantages of the Advantage plan. And there also are some of them that are PPOs that if you know you're traveling out of town, you call up the company and say, I'm going to Oklahoma. Here's my zip code and county I'm going to be in. They'll give you all the companies, all the doctors that are in your area that you can use in network out of town. Otherwise, when you go out of town, you are limited to emergencies only. You break an arm, they're going to fix it for you. But if you need follow-up, you got to come home. You get the flu, it's not an emergency. You're going to have to pay for it out of town. So again, it has its purpose, but it has its limitations. The other direction is called a supplement. When most people come to me, they say, Mitchell, I want something to supplement my Medicare. They don't realize the word supplement is a specific product. There are 10 of them, and they're also confusing because they're labeled A, B, C, F, G, N. And each one of them is the same as the next, meaning every A is the same. Every F is the same. So if you go to insurance company A, insurance company B, if you go to John's Insurance Company and you want an F, it's going to be the same from every company. So the only difference is price and service. Which ones have a lower price? Which ones are giving you better service? In 7 years, I have not had one complaint about a supplement. Here's why. Supplements pay for everything. A lady yesterday was asking me, well, what about this little thing? What about this little thing? Supplements pay for everything that Medicare covers. By the way, it's very important for you to know 2 things about Medicare. Only what's medically necessary. If it's not medically necessary, they will not do it. If I want a facelift to enhance this beauty here, I can't get it because it's not medically necessary. If Medicare doesn't pay for it, the insurance company not just won't pay for it, they can't pay for it. I've had a client call me up and say, my insurance company said they would pay for this procedure, and Medicare said no. The other thing you just have to know is, for a supplement, do you take Medicare? With the Advantage plans, you've got to ask, are you in the network? And you ask it specifically, and that's why I teach this. You ask, do you take Medicare Advantage so-and-so company? Because if you just say, do you take an HMO from this company, they might think you're talking about under 65 and not Medicare, and they'll say yes, and they might not. And once you go, it's your mistake. You have to pay the bill. With the supplement, it's great. You just ask, do you take Medicare? Anywhere in the country. So remember, before I told you on Advantage plans, the smaller ones, you might get 3 cardiologists. The ones with the larger networks, you might have 30. Well, with the supplement, you might have 3,000, because you can go anywhere you want in America and use a doctor. All you have to do is ask, do you take Medicare? Now, I mostly work with an F supplement because it pays, when I say everything, it pays for everything. The A, the B, the C supplements do not. You're paying a premium. So why pay a premium when you're not getting covered for everything? So if you take the F supplement, it pays everything. And the reason I emphasize it, because there is one little codicil in the things it covers that other ones don't. And that's called the 15% overage. You can go to a doctor that accepts Medicare, but doesn't accept the price assignment. So they can charge you 15% more. 15% more on a $100 bill is nothing. On a $150 bill, it's pretty low. But on a $40,000, $50,000 bill, it can add up. So an F covers every single thing. I have sent people to doctors, and they said, I have Medicare and I have a supplement. The doctor looked up on their list and said, we don't take that supplement. Client calls me up scared to death. I call the doctor up and say, yes, you do. When the insurance company sends you a check, are you going to send it back? Of course not. There is no network. And what I tell my clients is, don't use the word supplement. For some reason, doctors don't understand the word supplement. Just tell them you have a secondary. Here's my Medicare card. Here's my secondary card. They love it because they know they're going to get paid in full. Okay? The only disadvantage I see to a supplement is it does not include a prescription plan. So you have to buy an extra one. They're cheap enough. You can get them for $20. You can get them for $30. If you have one for $70, I only know 2 people that have one for $70 that they need that one. Other than that, there's no reason to ever pay that much. So you stay with the lower price ones because the price of the prescriptions are basically the same. They don't change that much just because you're paying more. I don't know why they even have that plan half the time. As for compliance, the compliance and the rules and regulations for Medicare are, I was in a liquor-related business once, and I thought that was strict. The compliance for Medicare is outrageous. If I'm walking past you, if I'm sitting next to you at a restaurant, and you're in the booth next to me, and I hear you crying, I don't know what to do with my Medicare. I'm scared to death. It's against the law for me to walk up to you and hand you my card and say, I can help you, call me. I had a gentleman walk up to me at my gym the other day and had a piece of paper ready to hand me his mother's phone number to call her up to make sure she had the right plan. I won't even take it to be tempted. It's against the law for me to make the first phone call. I cannot call you up first. You have to call me. I can send you an advertisement that has general information about turning 65, but I cannot approach you first. That's against the law. It can cost me my license. When it comes to seminars, just like this I'm teaching, this is considered educational. You noticed I haven't spoken about a specific plan. I won't. Or specific companies. I won't. A marketing seminar, I come here, I'm going to talk about one company, and I'm going to try to convince you to sign up for that company. And I can sign you up. Educational seminars, I can't even hand you my business card unless you ask me for it. I make a joke out of it. I tell the people that, and then, of course, they do ask. But I can't have a registration form. I did a CE classes for one of our members, as a matter of fact, Maria Wiegelman, and she teaches CE classes, and Medicare was part of it. And I can't get paid for it. I'm not allowed. It's against the law. I do it as a courtesy, and I love doing it. She has a registration form. People sign into the class. I cannot take that form. I cannot buy lists of emails and just randomly send you information. Again, it's against the law. One of my favorites that drives the clients crazy is, once I sit down with you and we're talking about Medicare, whether you sign up or not, doesn't make a difference. If then you say, Mitchell, that's fine, I know everything. Tell me about life insurance. It's against the law. I cannot tell you. For 48 hours, I can't speak to you. If your husband or wife walks in, I have to have them sign a piece of paper giving them permission to speak to them. You also have to sign the same piece of paper. If the neighbor walks in, I can't talk to the neighbor. If I'm walking out of the house and I see the neighbors next door, I can't walk over, give them my card and say, I just gave your neighbors Medicare. Would you like me to help you? It's against the law. It's there to protect you, but mostly it drives my clients crazy. So for patients to clients isn't that bad, but the rules are a little tough. You cannot leave your plan except for AEP, annual election period, October 15th to December 7th, except for special circumstances. You just turned 65, you just moved, you just got in or out of Medicaid. Very quickly, I'll also tell you Medicaid isn't that hard to sign up for if you do it online, and I can help people show them how to do that. But doctors can drop the plan anytime they want. Insurance companies can drop doctors anytime they want. If your doctor drops the plan, you're stuck with your plan, not your doctor. So you either pay to go see that doctor or you have to switch. So it's a little tougher on us than it is on them. There are a lot of other little things to go over in Medicare, but due to constraint in time and the rules and regulations that Craig are going to give you about Obamacare and things are going to be astounding and probably scare the heck out of you. So any other questions that you have for more specific coverages or information, I'll be here for the rest of the morning. I'll be able to help you out with that. But keep in mind, again, Medicare also is a very personal consideration. Husbands and wives have different plans. I have a wife who's incredibly sick and has one plan, and the husband who's incredibly healthy and has a completely different plan. There are no more groups. Everything is completely separate. Plus, another thing too is when you go from under 65 to Medicare, it's a completely different animal. I don't care who you've been dealing with in the company for customer service, it's going to change. So you might hate your plan under 65, but that same company might have a great plan over 65, and vice versa. So, and your neighbor's going to walk in and say, you know when you buy a new car, a new appliance, and someone comes and tells you the next day they found it cheaper? Same thing with Medicare. The neighbor's going to come in and say, oh, I got this, I got that. Well, but does your neighbor have COPD? Does he have low income, high income? Does he have diabetes? Again, very personal, very self-directed at each person. And that's how Medicare becomes simple, because all you have to know is what your plan does. You don't have to know what everybody else's plan does. You don't have to know the millions of laws of what they do. And I'll end with this. I teach as I go. My main mantra is in education before enrollment. One of the main things I teach, and it works, is how to politely threaten your insurance company. I don't know if I should put that on the air, but it's a simple thing, because when you pay for insurance, I don't care if it's car insurance or anything, you should get what you pay for. If it's not covered, I'll tell you, you made a mistake, it's not covered. But if it's covered, the insurance company should give it to you and take care of it. And they're rated on star ratings. 5 stars is the highest. The more stars they get, the more money they get. They want to take care of you now. It's not like it was 20 years ago. They want to keep you. They're actually starting to call up your home and tell you, hey, have you picked up your diabetes medicine? We're coming to your house and we're going to give you a physical. Because the more you use their services, the more the government likes them, the more the government gives them the money. So that, in a nutshell, is the Medicare programs. And again, if you have questions after Greg is done, we'll answer all the questions. Thank you.
Well, good morning. My name's Craig. I'm with CSR and Associates, and we write health insurance. That's about the end of the conversation with me. So here's the deal. You ever do things for a long time and almost forget what you're doing, right? So I've been speaking on the Affordable Care Act for literally 6 or 7 years now, and the presentation you're going to see has morphed over time. But I throw the first slide up this morning, and it's been a little while since I've read back through it again. So around 2010, we passed the Affordable Care Act. The Republicans talk about repeal and replace, and we end up electing President Trump and a bunch of Republicans, and they say they're going to repeal and replace, and then they don't repeal and replace, and then Trump signs executive orders. And so I'm sitting here this morning reading this bottom line on my slide. I'd originally written this during the Obama administration because the Obama administration was changing rules and laws literally on a whim. We couldn't believe anything they passed as law, couldn't believe anything they said. We literally just rolled out of bed every day and said, okay, how are we doing this now? And I almost kind of thought that was going to go away with a new administration, and then I realized it's not going away. So from the past all the way into the future, I think the Affordable Care Act is going to follow this one basic rule, which is the information that I'm giving you today is most accurate as of today. The rules can change at any moment according to HHS's rules and guidelines, which I thought was kind of funny. So here's the thing. President Obama said that he was going to cover everybody with health insurance. How is he covering you? Each and every one of us has a mandate to own health insurance or pay a penalty. One of the confusing things that's going on right now is people believe that the Affordable Care Act is no longer law or that the individual mandate doesn't stand. You might remember that when President Trump took office, one of the first things he did was sign this executive order theoretically eliminating penalties, fines, and mandates. The problem was that isn't what the executive order said. What the executive order said was, I'm giving HHS the right to eliminate penalties and fines and mandates if they want to. They did not do that. So right now today, everybody has a mandate to own health insurance or pay a penalty. Some things have changed right now, and so one of the main ones being, in years past, if you owned an individual health plan, you had from November 1st till January 30th to buy health insurance or change your plan. That's not true this year, so this year is a really big change. We have from November 1st to December 15th. If you call me on December 16th and you say, hey, Craig, I should have bought insurance, but I didn't, the answer is actually, I'm sorry, you can't have any health insurance and you're going to owe the penalty for not owning health insurance. So it's very important that we communicate to people that that date has shrunk a lot. It's gone from 3 months to 6 weeks. Everybody know where Craig's going to be in his office for the next 6 weeks? That's right, in my office. Now, I told you you're going to owe a penalty if you don't own health insurance. What's the penalty? It is actually $695 per adult, half that for a child, or 2.5% of your income, whichever is greater. That penalty will stand. As a matter of fact, the IRS released a letter just about 4 days ago saying you won't even be able to file your tax return if you can't prove that you had health insurance or pay this penalty. And so that's the e-filing. If you mail your tax return in and you don't have the proof or you didn't pay the penalty, they're sitting on your refund until you do one or the other. So the piece about we eliminated the penalties, you can throw that right out the window. They're now going to withhold your tax return until you do one or the other, own health insurance or pay the penalty. What I'm really here to talk about is what happened 2 weeks ago. And what happened 2 weeks ago is the beginning of that week, President Trump signed an executive order doing 3 things. What 3 things was he going to do? We're going to do interstate health insurance. We're going to do HRA reimbursements. We're going to do short-term medical plan revisions. What we want to know is, did it help us? Because there was so much talk on the news, this is going to be huge, this is going to be massive, everybody's getting better cost health insurance. Well, did they? We'll start with interstate health insurance. The idea behind interstate health insurance was we needed to introduce competition in health insurance. So the idea was if you could buy health insurance from anywhere in the country, now there's going to be competition and the health insurance carriers would have to bring the cost down. Is that true? Well, prior to the Affordable Care Act, it was actually legal for these association health plans to exist. The Affordable Care Act made them illegal. When they were legal, did my clients have huge benefits from doing association health plans? Well, kind of, and here's why. Prior to the Affordable Care Act, the Department of Insurance in a state set the rules for what a health insurance plan was. Here in Florida, we had 57 mandates on a policy. It can be covering spinal bifida, smoking cessation, obesity programs, whether it covers maternity or not. So we had 57 mandates on a policy. The idea being if I could go buy the policy out of Georgia that only had 20 mandates on it, which one's going to be cheaper? The Georgia policy is going to be cheaper because it has less mandates. The problem is, even though they're allowing interstate health insurance plans, the rules of the Affordable Care Act still exist. Unlimited lifetime maximums, preventative care covered at 100%. You know, we're going to cover maternity and mental health and all of these things. So the advantage we were getting from going from state to state isn't really going to exist in this circumstance. The second thing is, health insurance is not a widget. You know, I could buy this clicker from anywhere in the world. They can ship it to me. I plug it into my computer, hit the button, and it works. Is that true of healthcare? Well, no, it's not, because if I go buy a Vermont health insurance plan, am I going to drive to Vermont to see the doctor? No, I'm not driving to Vermont to see the doctor. I want to see a doctor in Florida, which means that carrier has to get a network in Florida. Doctors, hospitals, pharmaceutical companies, etc. You know, these carriers already sell all over the country. United Healthcare, do they sell all over the country? Yes. Aetna, Cigna, Coventry, Humana, they all sell all over the country anyway. This misnomer that we're going to have them competing because now they're going to be selling all over the country, they already sell all over the country. That's kind of a long story to tell you. I don't expect a lot out of interstate health insurance and this association health plan thing. The other piece of that that's important is we're not having a conversation about individuals, we're having a conversation about groups. So the idea is not that Craig can go buy a policy in Vermont. The idea was that Craig could have an engineering firm that was part of the engineering association, and his whole company, CSR and Associates, the engineering firm, could buy from an association health plan. So even if this does work, this will be a business solution, not an individual solution like people are thinking. At the end of the day, I'm not expecting a lot out of that. The next one is HRA reimbursements. This is massive. If you want to talk about game-changing things, this is as game-changing as it gets. Here's why. When the Affordable Care Act came out and the subsidies existed, many employers started questioning whether they should be offering group insurance or not. Maybe they should terminate their group insurance, give their employees some money, and let them go buy individual policies on the exchange, like we're going to talk about in a minute. The Affordable Care Act said that employer is not allowed to give those employees tax-free dollars to do that. In other words, I couldn't hand Mitchell $200 tax-free, then let him go to the exchange and get a subsidy and buy health insurance. They said it had to be taxable money. That slowed that transition down a good bit. It didn't stop it, but it slowed it down. The idea behind the HRA reimbursement is now the employer can give their employee a tax-free dollar. That employee can go to the exchange and buy an individual health plan like we're fixing to talk about with all tax-free money, and it's a game changer. The very second this conversation came up, I had 5 or 6 employers terminating their health insurance. I'm having conversations with new employers almost daily. This is massive. Employers are going to terminate their coverage like it's going out of style, right? Going to be a serious game changer. The last one is short-term medical plans, and if you're listening to any of the news media conversation here, what they keep saying is, hey, look, all the healthy people are going to leave the market. In other words, leave healthcare.gov or individual health plans that are written guaranteed issue, no pre-existing conditions. Well, why? That stuff's really expensive. And so by going to a short-term medical plan, the short-term medical plan is going to ask you a couple of medical questions. They can accept you or decline you. But if they accept you, it's going to be a lot less expensive. What the change here is, today, short-term medical plans can only be bought in a 90-day block of time. So Mitchell comes to me, he buys the plan. At the end of 90 days, that plan ends, and he had to buy a new one. Well, as long as nothing happened to him, it was fine. Or as long as something happened to him that was quick, it was fine. Mitchell breaks his arm, he shows up in the emergency room, it fixes his arm, and he goes home, and everything's great. But what if Mitchell got a bad diagnosis, cancer? He begins his cancer treatment, the plan's going to cover it because it said it would, but the 90 days ends, and they weren't going to write a new plan. So the risk was Mitchell actually got something serious, and his coverage ended. What they want to do here is extend it to 12 months. So Mitchell would be able to buy that plan to last the entire year. That's going to coincide with open enrollment. So if Mitchell had cancer and now he wants to move to Blue Cross, he just flips over to Blue Cross on the Affordable Care Act and he's good to go. That'll have some impact. it'll help some people be able to buy some coverage that's a little more affordable. How's this stuff going to be implemented? Well, if we look at the first part, the Labor Secretary has 60 days to develop their association plan proposals. He signs the executive order. They've got 60 days to say, here's what we're thinking. Then it goes out for the comment period for another 60 days or something, and everybody says they think that's a good idea or a bad idea. Then it goes back to them to form final rules. Then they come out with the final rules maybe middle of the year. Now people have to figure out, how do I implement whatever it is they just said they would do? So my expectation is we're really having a 2019 conversation about this really affecting us. This isn't going to be any time in the near future. Treasury Secretary and HHS have 60 days to develop their short-term medical rules. The short-term medical rules are going to go fast. We're already writing short-term medical plans. It's really just a matter of them saying, okay, you can do it for 12 months. The carriers can flip a switch. They do it today. Bam. My expectation is January, February, we're up and running with that, and you'd be able to buy those plans for 12-month blocks of time. That's going to happen pretty quick. The last one is the HRA reimbursement, what we talked about that's going to lead to all the employers terminating their health insurance. The confusing thing for me about this is, even though it says they have 120 days to develop these rules, before President Obama left office, he actually signed an executive order making this legal. We're already doing this right now. We're already doing health reimbursement accounts. The employers are giving the employees tax-free dollars to buy health insurance. It's happening today. They're just going to formalize it a little more. All right, we need to talk about how subsidies work, and we need to understand actually the last thing that happened that I forgot to talk about. The end of that week, 2 weeks ago, President Trump came out and said, I'm no longer giving subsidies to the insurance companies for health insurance. And everybody thought the entire Obamacare legislation collapsed and it was over. That's really the way the communication happened. Would you agree with me? Then the question we want to figure out is that true and what actually happened? So that's what we're going to discuss. If we look at how subsidies happen on the exchange, what happens is across the top is number of people in your family. Subsidies are available from 100% to 400% of federal poverty level. What's that mean in English? It means a single person can earn up to $48,240 a year and still qualify for a subsidy on the exchange to help them buy health insurance. Family of four can make up to almost $99,000 and still get a subsidy to help them buy health insurance. The median household income in the state of Florida is about $46,000. What does that mean? It means 60% of us or so qualify for subsidies on the exchange. Then how does it work? My buddy David's a family of four. He made $49,200. That puts him at 200% of federal poverty level. I'll tell you why that matters in a minute. Craig, he spends all day every day reading healthcare law, so he only made $16,000 last year. He's at 133% of federal poverty level. Why does it matter? Because depending on the percent of poverty level I'm at, that determines what percent of my income I pay for my health insurance. 133% pays 3, 250 pays 8. You can see how that works. Then what happened to David? David was at 200%. He's going to pay 6.3% of his income for his health insurance. $49,000 times 6.3 divided by 12. David can insure his entire family for $258 a month. When I'm asked if anybody benefits from health care reform, absolutely. David's benefiting big time. Huge win for him. What happened to Craig? Craig was at 133%. He's going to pay 3. $16,000 times 3 divided by 12. Craig gets coverage for $40 a month. Huge, huge win. What's the $5 question? Yeah, Craig, but what kind of coverage do I get? There's 4 kinds of plans available on the exchange: bronze, silver, gold, and platinum. The subsidy is based on the silver level plan. So to give you some perspective, I have silver level plans, $30 for the doctor, $60 for the specialist, $3,250 deductible if I'm admitted to the hospital. So good coverage, maternity, mental health, whole 9 yards. What happens is I enter David, I enter his wife, I enter his kids, I come back to David and say, your plan's going to cost $1,258 a month. Hold on, Craig, time out. You just told me David was going to pay $258. That's correct. David's going to pay $258. That means David gets a $1,000 subsidy to help him buy health insurance. Once we've established the $1,000, David can move up or down this chart however he wants. So if David says, hey, Craig, I can't afford $258, how much is the bronze? Bronze is $1,050. David has a $1,000 subsidy. He just pays $50 to insure his whole family. David says, I want great coverage. How much is the gold? Gold's $1,400. David has a $1,000 subsidy. He just pays $400 to insure his whole family. How does it work then? David goes to the marketplace and he picks a plan. Who heard my doctor doesn't take Obamacare? Right? Everybody's heard that phrase. It's actually a misnomer. There is no Obamacare. It doesn't exist. It's the same insurance companies, the same doctors' networks. For David that pays $258 and Craig that pays $1,258, it's Blue Cross, Ambetter, Florida Healthcare Plans, whatever. It's the same plans, the same doctors' networks. There's not an Obamacare, so to speak. David goes, he picks Blue Cross, he mails his $258 check to Blue Cross, government mails a $1,000 check to Blue Cross, everything's great. At the end of the year, David sits down with the accountant. How'd it go, David? Oh, it didn't go so good. I didn't make $49,000. I got laid off halfway through the year, only made $39,000. Oh, David, you shouldn't have paid $258 a month. You should have paid $158 a month. David's going to get a $1,200 refund right on his tax return. By the same token, how'd it go, David? Went great. Got a promotion, got a raise. Made $59,000. Oh, David, you shouldn't have paid $258 a month. You should have paid $358 a month. David's going to owe $1,200 back right on his tax return. So all of it's going to get adjusted at the end of the year. Now, David's really lucky. Because David's under 250% of poverty level, he qualifies for a second benefit called cost share. Cost share lowers the deductibles, lowers the copays, lowers the max out of pocket. To give you some perspective, I literally have clients that pay 70 cents a month in premium. It's $1 for the doctor, $3 for the specialist, $0 deductible, $750 max out of pocket. Unbelievable coverage. This is the point that brings us to what the president did when he said he wasn't going to give the subsidies anymore. Here's what happened. The Democrats are in a hurry to pass the Affordable Care Act, and they want to pass it before any of us really realize what's going on. So within that law, they create the premium subsidy, the $1,000 that David's getting, and they actually write it into the budget and they fund it, and it's legal. That's not going anywhere. That premium subsidy is legal and it exists. However, the next thing they do is they tell the insurance companies they have to provide this cost share benefit, this lower deductibles, lower copays, lower max out of pocket. But they don't want us to know how much it's really going to cost, so they never put it in the budget and they never fund it. So for 4 years, President Obama would just walk over to the National Treasury, grab a handful of cash, and hand it to the insurance companies. And he'd walk over to the National Treasury and grab a handful of cash and hand it to the insurance companies. Well, the president doesn't have the right to just grab cash and hand it to someone, even if he thinks it's good for the country. He doesn't spend the money, Congress spends the money. So some people sue, and it's working its way through the appellate courts, and before it makes it to the Supreme Court, we elect President Trump. Well, President Trump looks at the program and says, I don't have the right to go to the National Treasury and grab a handful of cash and hand it to someone. So 2 weeks ago, he says, I'm not doing it anymore, and everybody thinks that the whole world's collapsed. Not necessarily. Here's what I want to give. Sometimes we never give politicians enough credit for being smart. I'm going to give them credit in a way that most people wouldn't expect. Our Department of Insurance here in Florida is very smart. They're very astute, and they listen to agents, and they listen to how the world works, and we had already handled this. Here's how. I want you to ignore 2018 for a minute because it's just going to make you confused. In 2017, David bought this silver plan, $30 for the doctor, $3,500 deductible, The total premium was $993, so David got a $735 subsidy to help him buy health insurance. He paid his $258. We determined, see, one of the things about the way I calculate subsidies is I'm not calculating the subsidy, I'm calculating what David pays. The subsidy is the difference. But if David wanted the bronze plan, $50 for the doctor, $6,900 deductible, the premium was $921. You apply the $735, he was only going to pay $186 for the bronze plan. Oh, he wanted the gold? The gold was $1,207. Take the $735 out, he was going to pay $473 for the bronze plan. What did our Department of Insurance do that was so smart? We had already resolved this. We already expected President Trump to not give the reimbursement for the cost share. We didn't think he was going to slide that money through the back door anymore, so the Department of Insurance went to the insurance companies and said, how much is that going to cost you when that cost share subsidy goes away? The insurance companies said about 31%. They said, great, load the premium 31% for the silver plans. So they did. The $993 went to $1,300. Does David care? Does David care? No, David doesn't care, right? David still pays $258, so what happened is his subsidy went up from $735 to $1,042. However, we only loaded the silver plans because the cost share benefit is only on that silver plan. So if you look at the gold, it stayed at the bronze, it stayed at $921. Now he gets that for free instead of paying $186. The gold plan went from $1,207 to $1,207. Now he gets the gold for $165 instead of the silver for $258. Hence the name of my slide, Welcome to the Gold Rush. Because now what we're going to have is a migration of our clients from silver to gold. This brings up a part we need to talk about with what's going on with healthcare reform. We have a very big problem, and the big problem is this. The people in Washington, D.C. believe they can piecemeal out healthcare reform. President Trump is probably honestly thinking he's not going to give that reimbursement to the insurance companies anymore, and he's cracking Obamacare apart. And I'm going to sign this executive order, and I'm going to crack Obamacare apart. He's not cracking it apart, he's actually sending people to the exchange. That HRA reimbursement will cause employers to terminate their coverage because the most compassionate thing they can do for their employees is terminate their health insurance. Wait a second, Craig, what'd you say? In the old days, if Mitchell worked for me, I offered Mitchell health insurance because I cared about him. Today, if I care about Mitchell, I'm going to terminate my health insurance and let him go to the market. Because if I offer Mitchell group health insurance, neither him nor his children are allowed to go to the exchange and get a subsidy. Meaning, Mitchell says, how much for me, Craig? $200. How much for my kids? $400. Now, Mitchell's wife calls me on the phone because she can go to the marketplace. Craig, I need health insurance. No problem. How many people in your family? 4. What's your total household income? $49,000. Well, that puts you at 200% of federal poverty level. 200% of federal poverty level, you pay 6.3, 49,000 times 6.3 divided by 12. Now I'm insuring just Mitchell's wife for $258 a month, and Mitchell's paying $200 for himself and $400 for his kids because I offered him health insurance instead of him insuring his whole family for $258 a month. Here's the other thing. The healthcare reform law changed a lot of things, and one of the things that changed besides the definition of compassion is I don't do forwards math anymore, I do backwards math. Backwards math? What's backwards math? Okay, who's got a calculator? I need some help. Calculator, yep, that's right. All right, I have a taker. So Mitchell calls me up on the phone. He says, hey, Craig, I want to get health insurance. I go, great, Mitchell, how much do you make? Mitchell tells me he makes $40,000 a year. That puts him at 350% of federal poverty level. 350% of federal poverty level, he's going to pay 9.5% of his income. So we're going to go 40,000 times 0.095 divided by 12. Great, Mitchell. I can assure you it's going to be $316 a month. Mitchell says, wait, I forgot about them 2 kids. Not a problem, Mitchell. Now you're a family of 3 making $40,000. You're at 200%. Derek's laughing. 200% of federal poverty level would pay 6.3. So we're going to go 40,000 times 0.063 divided by 12. $210. I can insure Mitchell and his children for $210 a month because I do backwards math. I don't do forwards math. More people cost less than less people. If Mitchell then says, well, wait, Craig, I got a wife, then I just go in and I say, hey, great, I'm not going to make you do the math. That makes you a family of 4 at $200,000. I'll insure you, your wife, and the kids for $166 a month because I do backwards math. I don't do forwards math. This is a dynamic change because the world doesn't work the way we thought it did, in the sense that the subsidies don't work the way people thought they did, and at the end of the day, David doesn't care what the premium is. As a matter of fact, the history of the Affordable Care Act for me is this. This 400% of poverty level, when we started this 3 years ago, that number was $46,000, was the 400% of poverty level. So if David made the same $49,000 all 3 years, he started down here and his income is gradually moving lower on the percent of poverty level chart. As it moves lower on the percent of poverty level chart, what happens to what he pays? It goes down, right? Because he's not paying 8% of his income anymore. Now he's paying 6. He's not paying 6, he's paying 4. He's not paying 4, he's paying 3. So the irony of this is this. If you fit in this box, or your employees fit in this box, they're fine. And if you have a company and the majority of your employees are in this box, the most compassionate thing you can do for them is terminate your health insurance. Now, that brings up the question of this. Who scares Craig? Here's who scares Craig. People right along this line right down here. I'll give you an easy example. I have a husband and wife. They call me up. They're retired. They're 63 years old or something. They did a good financial plan, right? They worked with David. They're all set. They make about $64,000 a year. Maybe he worked in Martin Marietta, and he's got a little bit of a pension, and he's taking his Medicare. But every now and then, Martin Marietta wants to call him up and have him come back in and do some consulting because he's an expert in missile defense systems. The way this works is I say, great, you and your wife at $64,000 a year, you're going to pay about $350 a month for your health insurance. Your subsidy is going to be about $1,400 a month. Here's what you need to know, Mitchell. If you break $64,960 and you make $65,000, you owe $16,000 back to the federal government due on your tax return when you file it because you're not eligible for this subsidy anymore. But Craig, they want me to come in and do some consulting, and I want to do some consulting. I don't want to just sit around the house. I'm happy to go in and work 5-10 hours a week. That's great, Mitchell, but what you have to understand is you've got to make $95,000 so that you can pay the taxes, pay the $1,600 a month for the health insurance, just to be even with where you would be making $64,000. So in reality, you're better off designing the missile defense system for free, or just telling them to buy you a soda and some lunch and you'll come in and defend our country because you can't afford to work part-time. The guys that are along this line is frightening to me. Now, we need to ask the pertinent question, and the pertinent question is this. Okay, Craig, you told me the Department of Insurance was loading premiums 31%. I don't get a subsidy, I'm screwed. No, you're not. I told you our Department of Insurance is very smart. They went to the insurance companies and they said, I want you to file me a silver plan that's on exchange only that has this load of 31%. And I want you to file me a silver plan that's off exchange only and we're not loading it the 31%. So if you come to me and you're going to get a subsidy, I'm putting you on healthcare.gov. The load doesn't matter. If you come to me and you're not getting a subsidy, I'm not putting you on healthcare.gov. You're not getting this load because we filed the plans without it. Our Department of Insurance is very astute. One more thing we need to know about. Let's say you're not getting a subsidy and you want affordable health insurance. Our job is to provide solutions to people. So I'm always looking for the most innovative solutions. One of the things we started doing is we write business for one of the Christian sharing ministries. And the Christian sharing ministries have some medical underwriting, but if you're healthy and you're willing to agree to a testament of faith, I believe in Jesus Christ, He died on the cross for my sins, they've got plans and rates that are super affordable. So at the end of the day, much like Mitchell, my job is to figure out what's the right solution for you. Do we need to get a subsidy, not get a subsidy? Look at a Christian sharing plan, not look at a Christian sharing plan, because we have to figure out what's the right solution for you. Having said that, our time is just about up, so I think it's time for us to pause and see about taking some questions, correct?
And I'm sure there are quite a few questions out here. But wait till I get to the microphone to you so that way you can talk into it for the camera.
Derek Linton, Colonial Life. Craig, you said when you file your taxes, if you don't pay that fine, you won't be able to actually file your taxes. Well, my question is, you don't think that, let's say if what you're going to get back from the IRS supersedes your fine, you don't think the IRS is going to give you your return, your money minus those dollars?
Derek's asking a really good question. Why wouldn't the IRS just withhold the fine and send it back? I can't answer that question for sure, Derek, because all I can do is respond to the articles that we're reading. The articles we're reading say you cannot e-file. You won't be able to e-file if you don't either prove you had insurance or pay the penalty. And if you mail a paper app in, the article says they're withholding it. I'm not an accountant. That's not what I do for a living, but we probably have some qualified people in the room that might be able to answer that. All I can do is answer it based on what I'm reading.
Okay.
I've got a couple. One is, first off, I'm on the bottom line, so I am worried. You know, I had to
Right.
pay back my entire subsidy last year. I don't want to do it again, but I probably will. Anyway, quickly, does F include drugs? Does the F premium include drug?
There are no supplements that include drugs.
Okay, so it's F. Okay.
You have to buy a separate policy.
Does the Christian sharing plan include a drug program?
Medishare or the Christian sharing programs are a little bit different. They're really designed for the, what happens to me, if I end up going to the hospital. So when we look at the Christian sharing plans, a lot of them work differently than insurance. For instance, they might say, we're not going to cover preventative care. That's not an unexpected expense. We're not going to cover for medications longer than 6 months. We won't cover maternity out of wedlock because we're a Christian program. Having said that, they also do some things that health insurance doesn't do. One easy example of that is you want to adopt a child, we might have some money to help you adopt a child because that's consistent with our values. That's the long answer to your question. The short answer is no, they're not really designed to cover maintenance
Okay,
medication.
well, last question. There is no choice on Affordable Care Act. It's Blue Cross, My Screw, or My Blue. I mean, there's just it.
That's not true.
Okay, then help me understand how the Interstate, that's what I thought. I was all excited about the Interstate thing happening because I thought maybe some of these people would come back onto the marketplace
Yes.
because everybody left.
So what she's referring to is, in the individual market, what options you have are dependent on what county you're in. Last year, if you were in Seminole County, you could pick Blue Cross, AvMed, Florida Healthcare Plans, Ambetter and Molina. But if you were in Orange County, the only carrier that was in Orange County was either Blue Cross or AvMed. We're the only two carriers writing business in Orange County. That changes from year to year. So this year in Orange County, there's going to be more than just Blue Cross. This year in Seminole County, I think we're actually adding a carrier to Seminole County as well. We are just now getting our actual rates and plans for 2018 for open enrollment that starts on November 1st. So what, 4 days from now or 5 days from now? In the old days, and this is consistent with what Mitchell would have to say too, is In the old days, I did my health insurance with my nephew Timmy because he just got his license. Look, that really doesn't work today. Today, you need to find someone that's an expert in the field that you're trying to find coverage for. The way these laws work, the way subsidies work, and we didn't even talk about the group insurance today and what groups have to do, but I can definitely do that if you have a group plan and you need to know what's going on. But in today's market, you need to deal with someone that's really an expert in the area you're trying to do something with. It always amazes me. Clients will call me up on the phone, and Mitchell probably has something similar happen. I spent 10 hours looking at individual plans. I'm on the phone with them for 5 minutes. We got it narrowed down. They've got the right plan. They're totally happy. And I'm thinking, why did you spend 10 hours looking at healthcare.gov by yourself? It's a 5-minute phone conversation with me, and it doesn't cost you a dime more to have me do the research about what doctors, what medications, what plans. It's the same thing with Mitchell. It doesn't cost you a dime to have Mitchell's expert advice figuring out your Medicare solution. Why would you look through the 1.5-foot tall stack of stuff that you get? That's just the way I operate. I'm thinking I'm just going to go to the guy that knows. So,
Okay, Derek.
This question may seem like I'm trying to be funny, but I'm not. With that Christian plan, they're basing everything on values, not on necessarily what healthcare was judged on before. So, in essence, again, I'm not trying to be funny. If I'm a devil worshiper, I can't go get that plan?
well, part of getting a Christian plan is you agree to the testament of faith of being a Christian. So you would be correct. Now, maybe the Devil Worshippers Association has a devil worshiper plan.
Maybe they have
Not
their
to
own
be funny, maybe they do. But in this particular case, yes, you agree to testament of faith. And it's not even just devil worshippers. You know, I get people that are Muslim. I get people that are Jewish. And they say, hey, I can't agree to a testament of faith that Jesus Christ died on the cross for my sins. And so that's not a solution for them. My job is to just tell you what's available and figure out the right solution for you.
You also mentioned experts. Do you know any?
No. There are no experts in this field.
Well, I think that wraps up all the questions. Definitely a hot topic, definitely a timely topic, and that is the essence of what we try to do at MOROF is provide great education, great opportunities to learn and grow in the healthcare community and be a resource to, in this case, a little bit on the patient side, which we all are, as well as the medical professionals and providers that we have. Please feel free to continue any of the topics on our LinkedIn open group. We've got a closed group for the members, as well as this video will eventually be archived on the website and on our YouTube channel. So please feel free to check those out and subscribe and all those sort of things. So this is the last major presentation we have of the year, unless somebody else wants to show up on Thanksgiving Day and around Christmas. I don't think so. So have a great holiday season, and we will have our next major presentation on the fourth Thursday coming up in January, and we'll have some time to plan and figure out what some of those topics are going to be. So feel free to chime in if you have some good ideas for us. We always appreciate that. So have a great day. Thank you so much for being a part of Medical Office Resources of Florida.